Barbados observes Remembrance Day with a parade of pomp and pageantry. Donations to the island's war veterans are on the decline. And in sports, the Windies end the India tour on a losing note.
Credible, balanced, committed. This is the CBC Evening News.
And a very good evening to you. I'm Sophia Alsop, Cambridge, with this Sunday, November 11th, Armistice Day edition of the CBC Evening News. In our top story tonight, Barbados today paid tribute to the veterans of the two world wars and to those who lost their lives during those conflicts, as we observed Remembrance Day along with other countries across the globe. We get more in this report from Lorna Jones.
And the last post sounded.
It was a stirring tribute to the veterans and those who made the ultimate sacrifice in the two world wars during the annual Remembrance Day parade this morning. Governor General Dame Sandra Mason, Prime Minister Mia Amor Motley, Opposition Leader Bishop Joseph Atherley, senior officials from the Barbados Defence Force and the Royal Barbados Police Force, and members of the Diplomatic Corps all laid wreaths adorned with the signature red poppies at the Cenotaph in National Hero Square, the city. Today also marks the 100th anniversary of the signing of the peace armistice, which ended World War I. Hundreds of Barbadians also lined the streets along the parade route to pay their respects. The parade also featured an interdenominational service. Remembrance Day is observed in all of the Commonwealth member nations. Lorna Jones, CBC News.
Thank you so much, Lorna. Well, 70 world leaders also gathered in Paris for World War I centenary celebrations, or observances rather, with the French president telling leaders on Armistice Day that nationalism often betrays patriotism. Regrettably, Barbadians are no longer donating to war veterans as they did in the past. The Secretary of the Barbados Poppy League, Edna Moore, says contributions are on the decline. She reminded the public that there are still many who depend on the donations.
As people's fortunes are going down, so our donations are. Plus, people have the idea that the World War II veterans are dying out. World War I's have. They forget we have veterans from other wars, other skirmishes, other peacekeeping arrangements, other disasters in the island. We have a lot of veterans from a lot of encounters, shall we say. And they all belong to the Defence Force, and they all are Barbadians, and they all deserve assistance for what they have done.
The monies collected are disbursed by the Barbados Legion, and Deputy Chairman Lieutenant Colonel Athleen Branch explained how the money is allocated. She says there are currently 500 members, with 15 veterans from World War II still alive.
We also assist the widows, so the majority of those now are the widows of some of these vets. 23 of our Legionnaires are on a permanent welfare assistance, which means that we give them a monthly stipend for them to live on. The assistance is given in terms of medical expenses, be it for dental, be it for optical, maybe they have an operation, you know. And we also assist with minor repairs to the home. The Barbados Defence Force helps tremendously in that area in providing some labor. And for those who are not so mobile, we usually try and provide a ramp so that they can have access to their homes.
Well, we will move to news of education now, and in an effort to improve student performance, the Samuel Jackman Prescott Institute of Technology is going back to basics. This was revealed by the Institute's principal Ian Drakes as he addressed the graduation and awards ceremony for the class of 2018. We get more from Lorna Jones.
The graduation and award ceremony of the Samuel Jackman Prescott Institute of Technology came off under the theme Architects of Our Future. and Principal Ian Drakes encouraged the graduates to use the skills they have gained to help rebuild the country. He, however, revealed that across some divisions, there were declines in the numbers of graduates. Mr. Drake says to tackle the issue, designated foundation courses would be instituted as part of their Student Transition Education Program, or STEP.
In an effort to remedy this current challenge, a pilot would have been launched in the year under review, and the results depicted were positive for those learners involved. Furthermore, the high number of unit certificates presented this evening does indeed reflect a dire need for the type of intervention for our learners, as partial completion of programs indicate students are not grasping or completing some of the minor literacy and numeracy-based courses.
Valedictorian Melanie Worrell congratulated her colleagues on their achievements. She now holds a certificate in Nursing Auxiliary Studies and says finding out she was at the top of her graduating class was a surprise.
I could not sit, nor could I stand. All I did was cry. Never in my wildest dreams could I imagine standing before you today as valedictorian. Having to juggle school, work, and my 2 children was very challenging. But I am very glad to be able to show my children that it is possible to succeed despite the challenges that may come your way.
Acting Education Minister Lucille Moore noted that a number of the Institute's programs will come in handy as Barbados focuses more on entrepreneurship and reducing imports. One of these is a mechanical manufacturing engineering course, which focuses on computer numeric control.
It allows products to be designed and produced in a fraction of the time required when compared to manual production. Training in the use of CNC technology is thus essential to meet the current needs of the manufacturing sector in Barbados and is offered right here at the SJPI.
The SJPI is also working towards being fully accredited by 2020. Lorna Jones, CBC News.
Well, if you're out and about, a little news for you now. Motorists and pedestrians who are travelling along 2 Mile Hill in St. Michael should exercise caution at this time. This as an electric pole, as you can see there, is leaning dangerously over the road in the area of the Lloyd Erskine Sandiford Centre. The manager of communications and government relations at the Barbados Light and Power Limited, Jackie Marshall-Clark, says the public safety is of paramount importance and crews are currently on the scene. She says customers may be affected by an outage as their contractors work to rectify this problem, but they expect to have it resolved soon. Well, the Queen Elizabeth Hospital is marking 54 years of service to the Barbadian community, and they did so this morning with a church service at the Bethel Methodist Church on Bay Street. Members of the QEH Board of Management, executive directors, staff, as well as representatives of the Diabetes Association of Barbados were in attendance. The Chief Executive Officer at the QEH, Dr. Dexter James, says the new administration has planned to execute a number of health system initiatives. Dr. James believes the upgrade of the Accident and Emergency Department and its equipment will raise the standard of healthcare in Barbados.
This infrastructure will expedite the processing and sorting of first contact with patients and decisions on the seriousness of their condition. This will significantly reduce waiting times for this category, thereby freeing up resources to attend to deserving urgencies. Ladies and gentlemen, our target is to reduce waiting times for first contact with our healthcare providers from 45 minutes to 20 minutes and to reduce the door-to-doctor from 4 hours to 2 hours.
Well, Dr. James adds that while the QEH is focused on improving, the service that's currently offered is of a high standard.
The hospital has already attained international accreditation status at the gold level with Accreditation Canada International, and has under its belt a number of other international accreditations, laboratory or baby-friendly certification for breastfeeding, and the hazard analysis critical control point for improving food service operations. Our board intends to leverage the benefits of these programs to not only improve the tangibles around quality improvement and patient safety, but to meaningfully address the more substantive considerations around the patient care experience.